Welcome, everybody. Hello. I'm calling from sunny and windy Iowa. So that's why I always like to know um, a little bit more of where y'all from, what the weather is like there in Wyoming. And so yeah, it's very windy here too. And we've had lots of rain and thunderstorms, very wet spring for us. But I'm glad you're here. I'm excited to talk to you today. I'll go into my bio and background here in a little bit, but just some housekeeping items. This is being recorded. Feel free to ask questions as we go, and I'll look at them at the end. I'm a one-person show today, so I will answer all questions at the end too, but I don't want you to lose them. So you can either use the Q&A function or the chat function, and I promise to get to them at the end of the presentation. And that way you don't forget them, but also maybe I'll answer them as I go. So after the webinar today, either later today or in the next couple days, you'll get a recording of this webinar as well as the slide deck. And then I'll also send over a couple of the links that we talk about today too. So just to be cognizant of your time, let's go ahead and get started. So this is information on how to standardize Count the Kicks, our evidence-based stillbirth prevention program, into your workflow. So that's why I was wondering where y'all are coming from, if your health systems, county health departments, WIC, home visitors, really want to think through how you interact with expectant parents and how you can take what you learned today and implement it into your standard of care. It's all about standardizing this. The little faces that you see on your screen currently are just a few of the baby saves that we know about. When I talk about baby saves, what I mean by that is their parent has reached out and said, hey, I was using your app, or I knew about my baby's movement and keeping track of it because I saw a poster at my WIC, or my doctor handed me information about the Count the Kicks program. And I noticed a change in my baby's movement, and now my baby's here because of it. So thank you. So we have over 100 of these that we know about. We know there's lots more out there, and I'm just excited to share a few with you today. I did want to start off with a disclaimer. I want to acknowledge the sensitivity of this topic and the potential emotional impact it may have on some individuals. I encourage you to prioritize your emotional well-being, and it is entirely okay to step away from the conversation. I do have a couple photos in here that may be triggering for some people. So I just wanted to start off with saying that, but know that my heart is with you, and your mental health is really, really important to me too. So just make sure that you take care of that as we go about the conversation today. Like I mentioned, my name is Megan Ockett. I am the program director here at Healthy Birthday. Healthy Birthday is the 501c3 that created the evidence-based stillbirth prevention program, Count the Kicks, which you're going to learn all about today. My contact information is there on the screen, and it will be on the last slide as well. But anytime you have questions after this is done, or you want us to come in and do a more 20-30-minute conversation with your team, I'm happy to do that. My passion and background is in systems change and public health. So anytime I can come in and talk about integrating this into your workflow, I'm happy to do that. I also work on the research for the organization, as well as I work with our app developers to make sure that our app continues to run smoothly, is inclusive, that it gets updates accordingly, that we get feedback from the app users themselves, just a lot of different things. And like I said, we're based in Iowa. I'm based in Iowa. Our whole team is in Iowa, but we are a national organization. And I'm here to talking with you today because of the Wyoming Department of Health and the Maternal and Child Health Bureau. So just a huge shout out to that agency, because it's a partnership with them that you get all these materials that I'm going to talk to you about today. You can order them for free. You get trainings like this. You get so much of this information to be able to standardize this into your setting. So thank you to the Wyoming Department of Health and the Maternal and Child Health Bureau. So before we kind of jump into more of the prevention, Count the Kicks, and fetal movement monitoring, I wanted to kind of level set and set the stage. So stillbirth is a public health crisis. Over 21,000 babies are stillborn each year in the United States. It's approximately 7 times the number of those lost to sudden unexpected infant death. And that's not to underscore the devastation and tragedy that sudden unexpected infant death is or has on the family and the community. what I'm trying to do here is highlight the fact that we're losing more babies that to stillbirth than to that, and that we need to be talking about stillbirth and stillbirth prevention, just like we're talking about the Back to Sleep campaign and other ways to prevent infant mortality. So my goal today is to give you the tools and resources to be able to communicate and talk about stillbirth and stillbirth prevention with your patients and your clients in your community, just as similar as you would with any other public health campaign that has been successful, like the Back to Sleep campaign. So that over 21,000 babies equals 1 in 175 pregnancies will end in stillbirth. So stillbirth, which is obviously, if you didn't know, but hopefully is defined by the CDC as the death of a baby at 20+ weeks gestation. Again, it occurs in 1 in every 175 pregnancies. And so no pregnancy is immune. Stillbirth occurs to women of all races, ethnicities, income levels, and ages. So this is the latest data that we have, and breaking that further down in a national scale by those race and ethnicities numbers, you can see that there are some large disparities that exist and continue to persist around Black, Indigenous, and Pacific Islander communities. So these exist and persist, and we need to be addressing these with our systems change work that we do. So thinking about your own demographics in your own community, how this might impact you and the work that you do. We're going to talk a little bit later on about the impact that we can have on very rural areas where there's not a birthing center or where there's not any prenatal care for several miles, 30, 40, 60 or longer, much like Iowa. Wyoming's very rural too, and we have lots of birthing center closures. So I have some information on that later on in the presentation about how we can help bridge that gap and the importance of sharing this within the community. So we also know that stillbirth impacts a variety of other things as well. So the risk of severe maternal morbidity among stillbirth deliveries was more than 4-fold higher compared to live births, according to a research study most recently, and that we also know that it can cause prolonged and complex grief, according to Burden et al. From 2016. And we know about the economic burden. There's financial instability due to employment difficulties, reliance on substances to cope with the grief, or increased costs associated with hospital bills and funeral expenses. So on top of just, what you might think of as stillbirth impacting just the family unit, but it also impacts them mentally, financially, economically, as well as the community and the health system too. With that connection between stillbirth and severe maternal morbidity, we know there was recent research too that just came out that showed stillbirth is a significant contributor to severe maternal morbidity, SMM. According to this one research study, stillbirth was associated with an increased rates of SMM starting at 31 weeks gestation and non-transfusion SMM starting at 30 weeks gestation. So these results indicate an increased risk of SMM among patients with stillbirth. Investigators concluded SMM risk is increased not only due to the delivery hospitalization, but also at any time during the prenatal period and up to 1 year following that delivery. And what I wanted to share today specifically was one of our Count the Kicks ambassadors, Sean Sumelis. She is Count the Kicks ambassador for us in Arizona, and she works in honor of her son, Zach, who was stillborn in 2010, and the impact that had on her emotionally, physically, mentally, everything. And with her permission, I wanted to share her story. So she says in her own words, "The beautiful boy in the picture on the left is my son, Zach, who was stillborn at full term in 2010. Throughout my pregnancy with Zach, I raised numerous concerns that were consistently dismissed. 2 days before my son's death, I reported to my provider that he wasn't moving as much. Despite this, I was assured that everything was okay and he was simply settling down for birth. On July 3rd, 2010, Zach was stillborn due to a complete hidden placental abruption. I lost 3 times my blood volume and went into disseminated intravascular coagulation, which led to multiple organ dysfunction. The picture is the first time I held Zach in the ICU after coming out of surgery and my family being told that I had less than a 20% chance of survival. 14 years ago at this time, I was planning Zach's nursery, and I should be planning an upcoming 14th birthday party. There will never be birthdays to celebrate with Zach, and milestones like driving a car, graduating high school, or witnessing him start a family. I'm sharing my story with you today because while there's been progress in raising awareness about stillbirth, we must continue to amplify our voices if we truly want to tackle this crisis and prevent future generations from enduring such profound loss. So we hear these stories time and time again. I'm sure you've heard these stories, but this is why we do what we do, and what you do, and why this is so important to bring to your state so that we can replicate our success in Iowa, and save more babies in Wyoming. So the evidence-based stillbirth prevention program is evidence-based. How we bridge that gap, we've developed a proven early warning system for expectant parents, and I'll talk a little bit more about what that means. And we've saved lives in 36 states and 6 countries. And here are 2 Wyoming baby saves. Meet John Walker and Lena. We're so grateful that their parents counted their kicks to bring them home safely. Again, we have over 100 baby saves that we know about on our website. And you can read their stories, you can share their stories, their testimonials, but these are specific to Wyoming. So I wanted to share their cute faces. And to me, they almost look like they could be brother and sister, but they're not. So they're so cute. But go ahead to our website to learn more. And we believe with our program that we can save 13 Wyoming babies every year with our program. But what does that mean and how does that work? And so if we take that 13, but we're also thinking about the parents that can be saved, the maternal mortality, morbidity impact that it could have, and just increasing awareness of getting to know what's normal for your body, and that advocacy and that empowerment, that's huge. So there is research that shows a change in fetal movement activity has shown an increased risk of stillbirth. In fact, in the study cited on the slide, this case control study compared 153 individuals who had experienced stillbirth to 480 people with an ongoing pregnancy or live delivery, showed that those who had a stillbirth were much more likely to have had reduced fetal movements in the preceding 2 weeks from the stillbirth. Additional research that shows that due to an acute or chronic fetal hypoxemia associated with placental insufficiency, and fetal movements may decrease as the fetus slows to conserve its energy. So we're going to talk about this a little bit later on too. Like this research stated here, that alterations in fetal activity are associated with an increased risk of stillbirth. We should be educating everybody on the importance of tracking their baby's movement and reporting any significant change to their provider. You've probably talked about Count the Kicks in some way, shape, or form throughout the years of working with expectant parents. But what Count the Kicks is doing is standardizing that communication, is standardizing that information for you to take back. Again, like I said, we're evidence-based. We were named a best practice by the Association of Maternal Child Health Programs, the scientific review board. You can read all about our information, our education around that, of that best practice if you want, via the QR code. And then as part of the Hear Her campaign, which I know we've all heard about, to reduce maternal mortality in the US, the CDC ranks that baby's movement stopping or slowing down as one of the 15 urgent maternal warning signs. So taking that into account, we've been doing this for several years, over 10 years, and knowing that connection between maternal mortality and morbidity, and that CDC Hear Her, who we work with, has called that out, is really key as well. So again, this is not new information in terms of talking about stillbirth and stillbirth prevention via fetal movement monitoring, but what it is new is the tools and resources for you to do this in a standard way. I also wanted to highlight that we have been working with the Association of Women's Health Obstetric Neonatal Nurses, so AWON. And with this work that we've done, they, 2 things. One, they drafted a practice brief on what to do with patients with reduced fetal movement. And that is you can look that up on the QR code there. but it sheds light on the various aspects of fetal movement, emphasizing the need for education during pregnancy and interventions to ensure the health of both mom and baby. We're currently working with them on a pilot project as well, where we are piloting an algorithm in 11 sites across the country on what to do when somebody does come into the clinical setting with reduced fetal movement, because there's no standard of care. There's no algorithm of what to do when somebody comes in. So that is something that we're working with them, and we're piloting across the US right now, both in high resource and low resource centers or facilities, both in geography is wide and far. So look for more information on that. But this practice brief is public, and it's the first time a national medically recognized membership organization like this has recognized fetal movement monitoring and the impacts it can have on stillbirth. So we were really excited to be part of that. We held a webinar with one of the authors, and it's on our website if you are interested in watching that webinar. It's also highlighted in our online CE training. So there's a lot of ways you can rewatch that. And I'll send the link out too for you to look at that, that information about what this practice brief means for you, especially if you are that nurse in triage or you're talking to those patients every day. This would be a great webinar for you to also listen to. And then I wanted to share a little quote from Mabel's mom. Her mom said, "The only red flag that there was a problem with the pregnancy was my daughter's change in movement. I'm so grateful I had concrete data from the app, which we'll talk about, which gave me the knowledge that something was off and the confidence to advocate for my baby. All moms deserve to have the knowledge so their babies can have a healthy birthday too." I want to highlight some of the research behind the program before we get into implementing it, because I get questions a lot about this, and sometimes I think these slides will help answer those questions. I think one of my top questions I always get is, wait a minute, this is just going to increase anxiety in my patients, or my nurses are going to get calls all the time like, I can't do this. And my first thought is, you're there to be there for your patients. I think you can all agree the fact that you're here today giving up your time to take this training is key and shows that you're invested in your patient's health and well-being. Two, there has been research done that shows this does not increase, fetal movement monitoring does not increase anxiety. In fact, this research study that we did with Des Moines University and the Harkin Institute of our app users, thousands of app users, stated that 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. There's other research about this too out there. So I think the fact that we don't want to talk about it, or we think it's going to cause anxiety, is a little patriarchal, where we want to give people the choice, right? Like, let's give everybody all the information out there and they can decide for themselves and their body what works best for them. And we've kind of talked about this a little bit, but I think that we also want to highlight the fact that there's other benefits outside of stillbirth prevention. So fetal movement monitoring could identify pregnancy complications that threaten the mother's life. I'll talk about that in a minute. It could help increase gestational age, reduce NICU stays, all research-based, because if you think about it, and we know this, fetal movement monitoring and fetal movement is one very easy, non-invasive, low-cost way baby communicates with mom. Really, it's the only way baby can communicate with mom. So a change in baby's movements might mean mom has undiagnosed preeclampsia or potential abruption is coming. There's a lot of different ways. So monitoring it and understanding what's normal for their baby, and if something changes, to speak up, could potentially save both their life and their mom's life. Or it could be something, like I said, that they need to test for, like the preeclampsia, that they can monitor the rest of the pregnancy and deliver a healthy baby and keep mom safe up to her 37, 38, 39th week of pregnancy. So we know that connection between maternal mortality and morbidity. And one of the things that we issued a couple of years ago was this white paper that really honed in on that connection, where we had stories from 8 individuals across the United States where they shared how count the kicks and monitoring their baby's movements saved their life as well as their baby's life. And so you can read that here. I'll link it in the email that goes out too. as well, because I know you can't click on the screen, but it is all on our evidence page on our website, countthekicks.org, and I'll put that in the chat here too. But just a lot of information is out there for you to look at around that evidence. Some more evidence for you. BJOG, we were published in the British Journal of Obstetrics and Gynecology and the American Journal about our app. And so what the BJOG research showed was this. It showed that from the inception of the Count the Kicks program in 2008 to 2018, we saw a clear reduction in the stillbirth rate in Iowa when nothing else was going on. No other stillbirth prevention efforts were really happening. It also compared us to other states around us that didn't have anything going on either. They didn't have Count the Kicks, and their rates went up or stayed the same. So the BJOG study showed what this graph is showing you essentially is that downward trend. And that's what we want to bring across the United States. In Wyoming, we want to ensure that we continue this downward trend in every state. And that's what we want to replicate. Okay, I did a lot of talking there for a minute. A lot about research and data, how it's evidence-based. So now you're probably like, when is she going to get to the part about how to implement? Here I'm getting to the part where we implement. So to see the same reduction in stillbirth rate that we've seen in Iowa, the important thing is standardizing this. How did we replicate this here? How did we reach expectant parents through a variety of different ways? How do we bridge that gap in rural areas where Iowa is the #1 state or the worst state in the nation to have lack of OB care? Our OB per capita is like 50th in the nation. So how do we help bridge that gap when we have all of those things going against us? And I have a great video. It is 4 minutes, so I'll warn you there. It's a little long for a video I like to play in a PowerPoint, but it does a really good job, especially connecting the dots of fetal movement monitoring and technology in rural areas, which I think is really important to highlight for us in Iowa and states like Wyoming. So let's watch.
With the increase in hospital labor and delivery closures throughout the U.S., the lack of maternal health care is greatly impacting rural Americans. It can result in several adverse maternal and infant outcomes, including premature birth, low birth weight, out-of-hospital births, maternal and infant morbidity and mortality, and increased risk of postpartum depression. If the closest hospital does not offer labor and delivery services, a pregnant woman may have to travel to a different community many miles away to deliver her baby.
If that is what's keeping you from going in and checking on your baby, hours and minutes matter. Once you notice, go in, don't wait.
We have a solution.
He's wearing the cleats to help promote healthy pregnancy and prevent premature death.
From Sunday Night Football,
a free app a mother says helps save her baby's life,
to Good Morning America, the Count the Kicks program is making headlines.
We have a healthy baby girl and we could have had a burial instead.
Count the Kicks is an evidence-based stillbirth prevention program that teaches expectant parents the method for and importance of tracking their baby's movements daily in the 3rd trimester of pregnancy. A study recently published in BJOG, an international journal of obstetrics and gynecology, shows the Count the Kicks stillbirth prevention program helped lower the stillbirth rate in Iowa by more than 30% in the first decade of the program. This happened while the rest of the country remained stagnant. How do we save lives? We host community baby showers, webinars, and trainings with partners. To break down barriers to access, our free app is in 16 languages with a new web-based kick counter and bands for moms who don't have smartphones. For these rural moms, Count the Kicks education and awareness made all the difference.
I want other moms to know that the importance of using the Count the Kicks app and how simple and easy it is to use to count your baby's kicks and monitor the amount of time that it takes your baby to get those normal kick counts. And I also want other moms to know that it's not just is your baby kicking and moving, but is your baby kicking and moving in the same pattern and in the same amount of time? Because had I not paid attention to that and mentioned something to my providers, Kembra's outcome may have been different because her kick count had changed. The pattern had changed. It was still a normal pattern, but it had changed from what was normally hers.
I want other moms to know that kick counting is one of the simplest things that you can do in a pregnancy, and it has great reward. Everett was born back in March when I noticed a reduce in his fetal movement, and his kicks were just not normal. And it's so easy, it's so simple to do, and it has brought so much joy into our life. So if I wouldn't have spoken up back in March when I was nervous about COVID and I wasn't sure what to expect going in for a test and having him early, we wouldn't have this joy in our life right now. So I would just like to encourage other moms to just take the few minutes, 10, 15 minutes that it takes to count throughout a day. It's so simple and so worth it.
The free Count the Kicks app is a data download for mom's intuition. And when a baby's movement changes, time is of the essence.
If I hadn't been using the Count the Kicks app every day, I likely wouldn't have known that something was wrong. And we might not have known this beautiful, confident, vibrant little girl that we know today.
When you give the gift of telling someone about Count the Kicks, it costs you nothing but can truly save a life. One conversation can have a powerful return. You're affecting our trajectory in saving babies. There are more and more babies saved each year.
It's been a very impactful program here in the state of Iowa and certainly for our practice as well. I would ask all providers in the obstetric world, whether you're a generalist, OB/GYN provider, whether you're a midwife provider, lay midwife, otherwise, whether you're a high-risk maternal fetal medicine provider like myself, to take advantage of the information that Count the Kicks has available to you to provide your patients and help everyone decrease the incidence of stillbirth, one of the most tragic occurrences that we all have seen and experienced, because it's still happening in too great numbers. It needs to become a rare event.
Together, we can save babies and improve outcomes.
So I know that was quite long, but I think it does a good job of really showing you all the different ways you can impact and integrate Count the Kicks a little bit. But let's talk about that a little bit more in depth and talk more about the app and make sure you have all the tools that you need to take this back to your communities. So when should you start talking about this? ACOG recommends beginning counting at 28 weeks gestation, 26 weeks if they're considered high risk or pregnant with multiples, because this is really when research indicates baby has established a consistent pattern that parents can feel and track. And so I think there's important conversations to be had around that mark. I know, for instance, when I was pregnant, it was only asked about baby movement at 20 weeks, and it was just, have I felt baby move yet? So I think that's a common one, 20, 21 weeks to ask if they've started feeling baby movements, which is fine, but let's continue that conversation and have those open-ended questions going in and during the third trimester every single time you see your patient. And it's just a quick, tell me how your baby has been moving. What questions do you have about your baby's movements? I think also clarifying what counts as a movement, especially for those first-time parents. Rolls, kicks, jabs, swishes, pushes, anything except hiccups. Hiccups are involuntary, so they don't count towards the movement. And this is really how we educate and how we talk about fetal movement monitoring, is this nice little graphic. And so starting in the third trimester, if I was talking to a patient, I'd say, I want you to monitor your baby's movements. There's this free app. Let's go ahead and download it right now. Or here's a brochure with the QR code. I want you to use this every day in the third trimester, preferably around the same time. So you're going to encourage them to count every day, to pick a time when baby's most active, or just really what works best for them. I know people work a lot of different hours and shifts. So really just sitting down, putting your feet up, focusing on baby, and counting those movements around the same time each day to get that pattern is really key. The app, which I'll show you in a minute, is going to help them time the number of movements that they get and the strength of those movements. Or they can use paper kit counting charts, which we have available in multiple languages on our website as well. And then after a couple of days, especially with, the app will chart for them the average amount of time it takes their baby to get to 10 movements. So I'll show you that in just a minute. And then encouraging them to contact you or contact their provider right away if they notice a change. We don't want them to wait until their family care physician opens up the next day, if it's in the middle of the night or it's late at night, encourage them and say, I want to hear from you. I'm here for you. Please contact me, come in right away if you have changes, especially if they have that longer drive to the nearest birthing center, like that video just showed. So let's talk about the free app. And I should have changed this, and I meant to add a disclaimer or before the video, but the app is actually now in 21 languages. So we just added 5 new languages. So you can download the app. I encourage you to go do that right now as we're talking. So you have it on your phone and you can pull it out anytime you're working with expectant parents. Just search for Count the Kicks in your app store. It's available for free. There's no ads. This is our nonprofit organization created this. And how it works is every day in the 3rd trimester, sit down when it's time to count baby and you feel that first movement you want to start with, you tap that footprint that you see on the screen there. As soon as you tap that footprint, when you feel that first movement, a timer starts. So you tap that footprint every time you feel a baby move, push, swish, jab, all the way until you get to 10 movements. After you get to 10 movements, the timer stops. And on the next screen, you get asked to rate the strength of those movements between fluttery to fierce, 1 through 5. So then the person using the app will say between 1 and 5, how is baby's strength? They can add notes if they want, like reminders, or, I ate a lot of salsa and chips and I was gardening all day, whatever they want, they can add notes if they want. And then after that, they hit finish session and they get a really nice a visual representation of how baby's been moving. So they can speak up to their providers and say, this is my baby's normal, or this is not my baby's normal. I need to be seen right away. One of the key things that I would highlight, if there's one thing you walk around or away with from today, is the fact that we really want them to do this daily around the same time each day. That's the standard part of it, right? We want them to do this daily. They can download the history and share it with you as a provider or share it with their provider. We don't sell the app information or anything like that. We use some of it for research purposes, but again, that's all asked within the app if they're comfortable sharing anything for research. If they're not, we just don't use it, and everything's secured that way. So again, this is free. It's currently in 21 languages. We have some great resources on the app as well, especially for Wyoming residents. You have some specific ones if you're a Wyoming zip code, thanks to the Department of Health. One of those resources is our Find Help resource, where people can enter their zip code and find free and reduced cost resources near them. So if they're trying to find diaper banks or childcare assistance or housing assistance, they can do that through this app or this resource function on the app. They just enter their zip code. So go check that out as well. We're going to be talking a little bit about some of the misconceptions around fetal movement monitoring. I will check the chat at that time just to see what are some questions that you have, or what are some questions that you receive that you're wondering, that's surely a myth, right? That can't be. For example, we get asked a lot, well, baby's just running out of room, so their movements would change, right? And you say, well, baby's getting bigger, everything's getting bigger. Their movements might be more like jabs versus full body rolls, but people should still be getting the same amount of movements in the same amount of time as they got earlier. So that's one, for example. So be thinking of that. If you have any, I'm happy to answer. So today we're giving you a lot of tools to not just talk about stillbirth prevention, but to also provide information to patients and clients and community members that really meets them where they're at. By doing these 5 things, when you talk about stillbirth prevention and fetal movement monitoring, you're really honestly increasing their health literacy as well, because you're being equitable, you're avoiding assumptions, and you're providing all expectant parents, no matter their race, their gender, their religion, their socioeconomic status, etc., the same information and interaction. You're listening and you're learning. So this is where your open-ended questions come in. You're asking strategic and those open-ended questions about kick counting to help you assess the individual what the individual patient understands, feels, and desires. So instead of asking at 20 weeks, like I was asked, you're asking maybe at 20 weeks, but then you're asking again at 28 weeks, like, okay, it's really time to start tracking your baby's movements. Let's talk about this. What questions do you have? Can I see your chart? Can we download the app together? And asking every single time you see them. It should take 3 to 5 minutes is all. What questions do you have? Do you have any concerns? What would you like to talk about regarding your baby's movements, etc.? You're being clear and concise, and you're being honest, right? You're having a very honest conversation with them. So Count the Kicks is a way that could potentially prevent preventable stillbirth. I want you to do this to get to know what's normal for your baby. So you can speak up to me as your provider, or you can speak up to your provider if something changes. This is another way for you to bond with baby. It will help, hopefully reduce any anxiety you have. Let's download the app together, or let's read this brochure together and see what questions you have. In Iowa, I remember when I was pregnant, we did the gestational diabetes test, and I always had to drink it right there in the clinic, wait an hour for my blood test. That would be a perfect opportunity to say, if you do this in your area, go ahead and drink this, sit down, here's a brochure, read it, and then let's talk about it when you come back for your blood work as well. And you're being honest, right? Again, we don't want to assume that they might be worried or concerned if we have this conversation. We talk to pregnant people all the time about things that we need to be aware of. No drinking, no smoking, take your prenatal vitamin. Do you want to get this blood work done to look at these potential risk factors and things like this? So stillbirth is just another way we should be communicating and educating expectant parents about, and that we have ways to potentially prevent it. So that's, you're just giving them tools, and then they decide how to move that forward, and then you're reteaching it. That's where it comes back into always have this conversation with them so they remember, so you're talking about it. We want patients and pregnant people to see this a variety of different ways. Hopefully they're going to get it in the waiting room because you're going to have a poster up. Then they're going to see it in the bathroom because you're going to have a poster up. And then it's going to be in the patient room. And then it's probably going to be at checkout. And then they might see a billboard on the highway. And then they might get shown a Google display ad. So these are all different ways that they're getting this information, but then they have a provider or somebody they trust say, hey, have you heard about this? You should be tracking your baby's movements. This is how you do it. So how do you share this with them other than just talking at them the whole time, which we don't want, right? We want to have a shared conversation. So using the print materials that we have available because of our partnership with Wyoming Department of Health, you have a lot of amazing resources at your fingertips for free. So as I'm talking, I'd like you to multitask, because I know we can all multitask, and I'd love for you to scan that QR code and go into our website, click on order materials, and fill your shopping cart and order all the materials. I'm going to go through a couple of them today, but we will also be doing a drawing for $50 Amazon gift cards. So if you place an order today during this call, and chances are good, you might be a winner. So what we have for you are posters in English and Spanish. We have app reminder cards, and the posters are 8.5 by 11. So it's not like a big poster. It's just a nice piece that can easily go on a door or a wall. And then we have our kick counting reminder bands, which I'll show you in a minute. And then we also have our paper kick counting charts as well. So those would be great, especially if you're serving very rural areas where they don't always have access to Wi-Fi to sync the app. They would want to do paper kick counting charts and the bands. This is what our at a glance materials look like. They're a lot less text, more picture-based. These are specific to Wyoming. So we created this with help with the Wyoming Department of Health with the demographic in mind. And so these are great for those individuals that maybe English is not their first language, but really it's just for anybody that wants to have this in a less text, more picture-based way. So this is available for free as well on the website. And then you guys have some awesome material. You have in Wyoming fetal movement monitoring bands. So you probably saw this on the video that was shared. The woman who was kind of sliding the numbers across, that's what our fetal movement monitoring bands are. So again, what you can do is you can order these materials, these bands included. What comes with the bands is it comes in a pack of, I think 25, and you also get a postcard like you see there on the screen. It's front and back, and it's shares how to talk about Count the Kicks and how to use the band. So you can hand it to the mom, you can hand it to the person and say, here's the band. I want you to use this on our paper kick counting charts to track your baby's movements. Here's more information about how to do that. And you hand them the card. So you can order that for free on our website. So I wanted to add this link again as well. So you had a minute to go ahead and scan, and I'm just going to open the chat here. And I am going to put, so you can just do the link too. So this way you can order the materials, and then, like I said, you'd be entered to win a $50 gift card to Amazon if you place an order during the webinar today. So go ahead and place that order while I'm talking, because I know we can all communicate that way and multitask. So I'm just looking at the chat too, because the other thing that I wanted to talk about today, before we wrap up, is some more of those misconceptions that people may have or that you read about. So as you're ordering, I want you to think in the back of your mind, and, what have you heard in your walks of life that you weren't sure, or you question yourself? These are some of the common ones we wanted to highlight too, specifically, but please feel free to visit our website for more information on the research behind these and other ones that we have. So the top one that I tend to get the most, and the most I see online, is my baby should get 10 kicks in 2 hours, 10 and 2, right? Or 10 and 1. And I think that's just easy to remember. So people always think like 10 and 2. We think that for driving, think that for, counting your baby's movements. And so I want to highlight that every baby's different. The recommendation to get 10 kicks in 2 hours is outdated, and current research indicates that moms should work to understand the normal amount of time it takes their baby to get to 10 movements. My baby may take 25 minutes to get to 10 movements, and my friend Sarah's baby may take 5 minutes to get to 10 movements. She needs to know that 5 minutes is her normal. I need to know that 25 minutes is my normal. And I don't want to compare to previous pregnancies either. I have 3 kiddos, and my second child took 30 minutes or more to get to 10 movements when I counted. And I was always comparing her to her brother, who was 5 minutes or less. And so I went to triage about 3 different times because I wasn't feeling her like normal. And each time they did the additional tests that they should do, and she was fine. And I just didn't know what her normal was. I was comparing her to my previous pregnancy. How great it would have been to be handed a Count the Kicks brochure, or at the time the app had just come out. This was in 2015, to say, hey, use this, get to know your baby's normal. Because then I'd be a highly educated individual that understands what's normal for my baby and know not to compare her to other ones. So she was born healthy at full term, totally fine. She's now, a spirited 8-year-old. But again, that 10 and 2, 10 and 1, it's outdated. We want to talk about getting to know what's normal for your baby. The other common one that I like to address in these presentations is the common misconception that if baby's not moving, I should drink something cold or eat something sugary. I've heard Mountain Dew. I've heard do jumping jacks. I've heard shake your belly. You see that all the time on TikTok. And so what research says is that fetal movement monitoring should be done without interventions like sugary drinks. That A1 practice brief also addresses this and says we do not want to do interventions to get baby to move, because if baby's not moving like normal, why are we trying to force baby to move? It's just like you and I. When we're sick, we're resting, we're conserving our energy, we're on the couch, we might be sipping some water, but we're not chugging Mountain Dew to get up and going. We're not chugging coffee to get energy levels up. We are conserving our energy. We are resting and sleeping. Same for baby in utero. If something's going on with baby, whether it's infection, umbilical cord, whatever it is, and their movement has changed, they're conserving that energy, there's a reason for that. And we need to get things checked out. Hopefully 9 times out of 10, everything's fine, but we want to make sure we catch that one time where maybe something's going on with mom or the baby that we need to address. So really here, just quick and easy, here are the instructions. You're going to instruct instructions on fetal movement monitoring to all patients. You want them to start counting in the third trimester, that 28, 26 week time frame. How long does it take to get to 10 movements? They're going to be timing that, track the time each day. Again, it's not just movements, or it's not just kicks, it's all movements, kicks, jabs, rolls, anything except hiccups. And then that's how they determine the normal movement pattern for their baby. So to standardize it even further, I'd love to have more conversations about this with you, but there's a lot of opportunities here. So currently I'm working with 2 health systems, three, but one in Nebraska and Kansas that come to mind, Kansas, Missouri area, where we're integrating discharge paperwork. So after visit summary, we have gold standard forms that people can take. And so like in my case with my triage, I went home each time. And on my discharge paperwork, it would have been great to have this information about counting kicks and how to do that with the QR code. We have that gold standard. We've had hospitals implement that into their records. So we can do that with you. We come in and do training for the team, grand rounds. We also can provide like social media toolkits if you all have your own social media platform, newsletters. There's lots of different ways. If your health system uses something like Baby 360, we've talked to them about updating their language around fetal movement monitoring and pushing people out to the app. What's the downtime? What's the wait time for the procedures? Like the discharge or the gestational diabetes drink. Could you add a message in your patient waiting room on the TVs? Could you do a message on your audio recordings? Do you know how to prioritize calls that come in? Instead of leaving a message, they should talk to somebody right away. There's lots of different ways. What we do is we meet with you and we kind of go through what your health system, how it works, how big it is, all the different pieces that you have. And then we come up with a plan together to really strategize that conversation and those next steps. But the standardization is always the same. You're going to be talking about the importance of tracking your baby's movements, show them the app or the fetal movement bands, and ask them about it every single time you see them. We also have amazing ambassadors. This is another great resource. Women across the nation who are invested, either they're lost parents like Sean, who you heard about earlier, or they're birth workers, or they're just passionate. And they can come in if they're in the state living there, they can come in and do in-person events, media events, versus where I'm mostly virtual, unless you want to fly me out for some reason. But they're great individuals who are expertly trained in Count the Kicks. So as I wrap up today, I hope you took a moment to order materials as I was talking. Follow us on social media, sign up for our newsletter. You can always reshare our information. I'm happy to answer questions. I know we have some extra time, so I just wanted to make sure I had enough time for y'all to, 1, place an order, but 2, answer any questions that you may have. So if you don't have any, I just thank you for your time today. I know how busy you all are and how important this is. So I'm just so grateful that you took your time to come listen to me talk about my passion for 50 minutes. And I hope you have a wonderful sunny and windy day in Wyoming, or a sunny day in Arizona. But yeah, I'll stay on for a couple minutes. Feel free to jump off and enjoy the rest of your afternoon. Otherwise, ask a question, but I will send an email out with all this information. If you order materials and you got entered into the drawing, my colleague, Sarah, will contact you with that if you win the $50 gift card. So she'll contact you that. So thank you everybody for all that you do. Have a great day.